Okay, so as Prof. Allam has mentioned, what I'd like to share with you is about a particular group of people. I'm pretty sure during the COVID-19 pandemic, you have seen lots of research, those who are in academia and research, you have seen lots of research on mental health issues. And we have looked at, and even I worked on a global study looking at 18 countries, looking at the community people, looking at the healthcare professionals. What is the impact on COVID-19 pandemic, specifically on their mental health? But this research that I'm going to share with you is about us. I'm an academic, I'm a researcher, I work at a university. So when we work at a university, definitely students are the key part of the people that we deal with. There are lots of research that focuses on students, but what about us as an academic, as a teacher? What about our health and well-being? So when I thought of this thing, I thought that, okay, let's look at this in further details. That is the thing I'm going to share with you today. So during the COVID-19 pandemic, you know, these higher education institutions, they had a huge impact. And this impact was really due to this changing pattern of their teaching, because many of them were not prepared to go online. So that was one of the struggle. Apart from all of this struggle and the fear and the coping they had as a community member. And therefore, they faced dual challenges. They had job insecurity due to this financial crisis. On top, they also have this physical and mental health impact on them during COVID-19 pandemic. Now, this ongoing global crisis in the health education institution definitely has impacted on their psychological well-being, and it is still continuing. I know that pandemic is really, we don't want to even listen to that word pandemic, but that impact still ongoing. There has been lots of job cut. I don't know the situation. I'm pretty sure that is the same around the world. In Australia, many people, many of my colleagues lose their job during this pandemic, and it is really impacting. But those who are continuing, what about them? What about their challenges? Did anyone think of that we need to also look after them? We also need to have that evidence. So thinking of this, we thought that, okay, let's have a look at the gaps in evidence. I was really interested to look at the job insecurity, burnout, psychological distress, and coping among the staff. And when I say staff, I also wanted to look at not only on the academic staff, but the professional staff, the admin staff, who are also doing lots of work for the success of the students. What about them? So I tried to look at the evidence, whether there is any evidence, even if it is not within the pandemic or post-pandemic, is there any evidence looking at this group of people? I was really keen to look at the extent. I was really keen to look at the factors. But there was a positive literature. So I thought that, okay, let's do a study focusing on this. And I also wanted to know about the status of comorbidities, about their risk factors, about the COVID vaccination, long COVID. And as I mentioned, I also wanted to look at on both academic staff and professional staff. So that was really my objective of this study, to look at the extent and the factors associated with job insecurity, burnout, psychological distress, and coping. It was a cross-sectional anonymous online survey. We selected higher education institutions, and definitely we used the snowball sampling using my network. We invited the staff, irrespective of their responsibilities. It could be the leader, it could be a junior staff, senior staff, admin staff, academic staff. We invited all of them. And we invited them to fill up the study questionnaire. We distributed the survey link through QR code, through email, and we also distributed this thing locally at the participating institutions, and we displayed this QR code and encouraged staff to participate in that survey. In terms of study tool, we used a structured survey questionnaire. For each of these outcomes, we use standard, validated, and reliable tool, and many of you definitely will be familiar with these tools. We use this tool to estimate the extent and the factors associated with all of these 4 outcomes. Within a short period of time, we got participants from 16 countries. We ended up with over 2,300 people and staff who are working at different universities. We had participants from Asia, Australia, Africa, Latin America, and UK. I just share with you briefly about our study participants. So mean age was 43 years, 61% were females, more than half were academic staff, and most of them were working full-time. Interesting thing is about multiple comorbidities. 1 in 5 staff reported they already have multiple comorbidities, not a single comorbidity, multiple. And 1 in 10 mentioned they already had the pre-diagnosed mental health issues. When we asked about their behavioral factors, we found that 1 in 4 mentioned they are ever smokers, and 1 in 3 mentioned that they drank alcohol more than once in the last week. When you ask the question about their increased alcohol and smoking behavior, 35% mentioned that they have increased their smoking habit, and they have also increased 15% mentioned they have increased their alcohol intake within the last 4 weeks. 1 in 5 mentioned they did not do any physical activities. We also asked about the experience of the COVID-19. 66% mentioned they are COVID positive at any point in time. 71% mentioned they had triple vaccine. 1 in 3 mentioned they had symptoms of long COVID. Now, if I want to look at the healthcare seeking behavior of this staff, when we are really busy in looking after the student satisfaction, student well-being, and all of this, what about us? One of these things is mental health that I'm going to share in details. But what about the physical health? So 8% mentioned that they never checked their blood pressure. 59% mentioned they never checked or measured their blood lipid profile. 21% mentioned they never checked their blood sugar. And 17% mentioned they never visited for a healthcare provider for any type of screening. Now, if we look at those 4 outcomes, we have found that 15% mentioned that they have job insecurity. Most of them mentioned they did not have job insecurity, so that is really positive. 1 in 3 mentioned they had high burnout. 73% of our staff mentioned they had moderate to very high psychological distress. And 58% mentioned they had medium to high resilient coping. When we looked at different countries who participated, we found the lowest prevalence of job insecurity was in Turkey, 6%, and the highest prevalence of job insecurity, 27% in Australia. When we looked at burnout, Pakistan reported lowest prevalence of burnout, 3%, whereas the highest prevalence was in Australia. When we looked at psychological distress, lowest prevalence was reported from Oman, and the highest prevalence was reported from Turkey, 88%. But even when I say lowest prevalence in Oman, still it is quite high. 61% staff reported they had moderate to very high psychological distress. And in terms of coping, lowest prevalence was in Australia, 40%, and highest prevalence was reported from Mexico. Now, I also tried to look at, okay, what's happening specifically in Australia with a small group of population. When I looked at job insecurity, burnout, moderate to very high psychological distress, and coping, it did not differ that much compared to the global results. I also narrowed it down to my university. I tried to look at, okay, is there any difference? So as a whole, there was not that much difference when we went into further details to look at the local level at the university. Now, if I look a bit more about the factors associated with each of these outcomes, in terms of job insecurity, I'm trying to present this thing in a very simple manner, not going through the statistical jargons. The levels of job insecurity was double among the staff who are working part-time, who are working in research, those who reported multiple comorbidities, and those who reported mental health issues. Also, levels of insecurity was doubled among the people who reported moderate to very high psychological distress and who reported burnout. And these levels of insecurity was triple among the people who had both roles. In Australia, we say they had this academic role when they need to do teaching and research. When we looked at burnout, levels of burnout was double among female, among the leadership people, those who had any comorbidities, and those who had job insecurity. This burnout levels was triple among the people who had moderate to very high psychological distress. So think of the situation of the staff who already had the psychological distress. On top, they also have the burnout. So think about their situation on the both physical and mental health. However, when you looked at this, levels of burnout were 63% less among the staff who perceived their own mental health as good to excellent. So that also indicates that it's important whether the university setting, whether the work setting is providing enough support so people are feeling resilient and they perceive their own mental health as good to excellent. When we looked at the psychological distress, levels of distress was double among the people who had the admin role, those who had comorbidities, people who were smokers, those who had job insecurity. And these levels of distress was triple among the people who reported burnout and who had existing mental health issues. Finally, if we look at coping, the levels of coping was double among the senior lecturer and the professor with this title. I don't know really what is the reason for this thing. Those who were smoking, those who were drinking alcohol, their coping was also double, and this coping was triple among the people who perceive their own mental health good to excellent. But levels of coping was 25% less among the people who had admin role and who had leadership role, those who had comorbidities. The main challenge of this coping was among the people who already had the mental health issues and those who had reported moderate to very high level of psychological distress. The levels of coping was 54% less. Well, to conclude, so it's a small snapshot that I shared with you. So we looked at job insecurity, burnout, psychological distress, and coping among the staff, both university academic staff and the professional staff, and the high group of population. So it's important to address those factors. And then it's important to look at the support strategies, the policies, and the well-being support strategies for the staff who are working at the university settings. Many times, as I mentioned, we focus as an academy, we focus on the well-being, we focus on the satisfaction of the students. We had to look at the investigation and any issue related to students, but what about us? So it's important that staff also get the support from the university setting. And this is probably the first study that looked comprehensively about all of this outcome that I shared with you. And we are really happy that we got this global study published a couple of months ago. I'm happy to share the link in the chat box if you want to have a look at the details of the results. We also published a couple of newsletter articles. It was published in the Times Higher Education, and it was also published at WASD. I'll share both links in the chat box. If you want to have a look, please feel free to have a look. And I would like to acknowledge all the participating organizations who participated in this study and who volunteered their time and provided the evidence. And the next step will be really to look after the staff, investigate what's happening with this, what about the health promotion activities and strategies that are in the place, and where is the scope of improvement to support health and well-being of the university staff. With this, I'd like to thank, feel free to connect with me, scan this thing, connect with me in LinkedIn, feel free to reach out to me at any point in time for any issue that I can collaborate. If there's any question, I'll be very happy to respond to your question. Thank you.